Hello and welcome. I'm Dr. Adam C. I'm a chiropractic physician here in Garner, North Carolina, and I want to share with you 3 things that your doctor probably isn't looking at, and you're probably wondering, why do I have a thyroid problem and why is it not gone? Why am I still having issues with it? What caused it? Well, there are 3 things that we typically find that cause your thyroid to mess up. And in our thyroid recovery program, these are 3 factors that we address. In our consultation, we'll actually address these 3 things for you as well. So look at the first one. It's going to be inflammation. Inflammation is a big pusher to create thyroid dysfunction and to cause the receptors not to work well at the cell to where those thyroid hormones aren't binding. Infection is another one that we see countless times, especially if you've been diagnosed with Hashimoto's. Infection is usually a culprit a lot of times for that particular autoimmune disease. A lot of times we find toxins are also there. Your doctors are not addressing this in people. We're bombarded with toxic load today, and we have to see if this is an issue for you and your thyroid. Third thing that we look at are neurostructural problems. This is addressing your nervous system, checking your structure, because your structure is your foundation. Your nervous system coordinates and controls everything in your body. So how do we go about fixing these things? Well, we're going to detect those in the consultation that if you want to schedule in my office, we're going to test these 3 things for you. The first one that we test is what's called the Medi-Oxy test. This checks for inflammation, checks for oxidative stress to see if your body is reacting to it. We're also going to check for toxins. We do what's called the visual contrast sensitivity. The optic nerve is very sensitive to toxins, and this is a great way that we can detect whether you are dealing with those or not. And then the last thing that we do is we're going to check your nervous system. We're going to do a neurologic test to see which side of your brain is not performing well. We're also going to look at your posture. Your posture is one of the first places that we see nervous system, where your nervous system is not doing very well. We're also going to check movement. Movement also tells us how well your nervous system is doing. I look forward to seeing you. Thank you for watching.